everyone. Hello, Elisabeth. I am a little bit confused and sorry to be present remotely because actually I was intending to come to Chamonix, but unfortunately I had this very last moment constraint with this meeting, political meeting this evening that I have to attend. So please forgive me. I will try to do my best to make sure that despite this distance, it will be interesting and not really difficult for everyone. Well, you're actually lucky, François, because you're the only person for who I actually accepted this format. And finally, just as we have already said, you are very much used to coming to see French through either radio or some other mediatic means. So for you, it won't be a very big difference finally. So we will be able to dive deep into the topic, and it will be quite special because we will be here in front of everyone and not the journalist. So this will be the opposite of the normal situation, I would say. So you are the journalist, and you are actually introducing to the French people all the challenges and stakes from the economy point of view that France has to face, and your influence as well as the influence of other journalists. But I would say especially your influence, because you are an economy related journalist, is major. So finally, what all the presentations and analysis have done is that this is not really French, and I would like to give two examples here, because for a couple of weeks right now we have been always hearing two important things. First of all, the holidays, public holidays, and their deletion, and also the Dugman tax. So I think that this is kind of a biased way of seeing things. What do you think about that? Well, yes, I totally agree with you, and I totally agree with Isabel as well, because I think that this is completely out of line with the problems that the country was facing back then. Well, the comparison, I think that is quite illustrative, but probably a little bit trivial. This is Constantinople. Actually, well, a lot of people were talking there about the sex of angels, or, well, meaning that it was the debates that were absolutely useless. And it was to distract the attention from the Turks that were here menacing everyone. So here is pretty much the same thing, and I believe that François is basically the best specialist on all of this questions. But we see that the problems are here as well as the world, which is facing a very turbulent situation. So first of all, this is very much explained by the properly French characteristics, but also it can be explained by what I would say we are coming out of this big parenthesis, if I may call it so, and if we're trying to place it in time. So it started with the fall of the Berlin Wall, and it finished at the very beginning of the Ukrainian war in 2022. So it was 35 years approximately of exceptional calm that has been marked by the United States, that were the hyperpower, just as we have already called it, which actually allowed us a worldwide peace, practically a worldwide peace, at least a European level, which actually allowed us to have this peace practically under the tutoring of the United States. And that allowed us to have this globalization. So Europe was pretty much a Grand Canyon at that time, because it was united between the eastern and western part, but it also allowed Europe to a little bit lighten up on the military investments and to get the dividends of the peace that we have invested. And sorry for being really rough here, we have invested all of this in things that were not very useful, like the decrease of the working time in general in European countries, but also in France. Well, all of this is over. This parenthesis has finished with Trump. It has closed. So I don't really know what is the average age of the participants of CHAM, but I think that all of us, well, we are all young. All right, I understand. Well, younger than me, probably. All right. But I would like to say that essentially most of our adult life has been lived inside this parenthesis, and we believe that this is something normal. But no, this is not the case. The normal world is what we're facing right now. So we are going back to the normal world, this confrontation of the big powers that are actually increasing this necessity of investing, because we have the aging of the population, but also this re-equipment in terms of defense, but also the transition, ecological transition, I mean. So this is the usual world. And from time to time, we are facing these periods that are like this big parenthesis that I have just mentioned. Before that, we actually had the United Kingdom that was doing the same thing at the end of the 19th century. But all of this was over at a certain point, and right now that's the same thing. And right now we see that France, our country, is very much weakened by all of this, which is very worrying. And we are talking about it in the debates. Well, weakened. Why weakened? Because we see that we have problems at the level of the government, and we can talk here about the attempts of Mr. Le Cornu, because we can see that, well, the margin for maneuvers is very limited for him. And then we also have these budgetary limitations that are here, and we see that our president hasn't done a lot of things here. And that's what we face in the current situation. So we are here a little bit weakened, while the world is basically rolling. And we are basically focusing because we would like to, we are tempted to go back to the previous debates. So, François, we actually want to go back to the healthcare issues because we understand that finally it is not sufficiently tackled. Well, I don't really have a lot of time to tackle it right now here, so I would like probably to go back to these questions because we understand that some of the very important big issues related to the healthcare are not even mentioned. So we hear in all the debates related to the healthcare very little talk about all this. Before that, we have talked about the innovation, but also this problem related to the sovereignty, or also the problems related to the innovation with this big stake that, let's say, custom rights can represent as well. And right now they are present here, so they will definitely create a number of difficulties. The decisions by the United States, and some of the participants have already said that the innovation can be threatened by some of the measures that are being implemented right now in the United States. So all of this, basically, it would be good if the media mentioned all of this, if the media talked about it. And finally, well, we are talking about this two additional holidays, or two holidays that two public holidays that should be out, or this tax or something like that. So these are the topics that are irrelevant, I think, from this point of view. Well, I will tell you something, Elisabeth, that probably you will find shocking, but I believe that globally for French, health is not an economy-related topic because health is social security. It is also the state. So this is part of the fundamental rights that is guaranteed, I would say. And every time we're going back to the origins of the social security, 1945, the CNR, as we called it, and everything. So in the very core of the French identity, there is the social model, this French social model. And in the core of this model is the healthcare. So there is this social security. And of course, this is a noble thing as well, I would say. But from all of this result the fact that healthcare is no longer part of the economy. And it actually is illustrated by the fact that for French, this is the system that is basically free. Well, I will give you this figure, but I believe that you all already know. So everything, whatever the person has to pay after Social Security, but also after the complementary, is approximately 8% or something like that. So that's basically the figure that is the lowest in the whole world. And it actually went lower and lower for the last 30 years. And that's actually the opposite of what the associative sector feels and perceives, because they actually are paying less and less, because the healthcare is becoming more and more free and less related to the economy. So I believe that because of that, it actually, all of this prevents us of considering this sector, because when we're looking at this dimension, well, of course, this is not just the economy-related topic, because we have many other factors that are here as well. But it is also a topic related to the economy, and specifically for a country that has difficulties in terms of budget and that has socialized a very big chunk of the treatments and care. Well, yeah, we will go back to it, François. I actually wanted probably to give the floor to Franck because he also had a lot of questions about this specific points. Yes, François Lenglet. So probably going back to what you're offering about the fact that the healthcare is becoming more and more free. Well, you just said it, and it is basically perceived as something practically free. So you have said, anyway, well, I believe that you have highlighted it several times. You have talked about the franchise, the offering of the franchise. Well, it means that the first hundreds of euros of the refund by the Social Security will be paid by the patient. So I wanted to ask you whether in the current context, when we're talking about this franchise, because we see the fears and the oppositions, do you think that this concept of franchise, we do understand it and we already know it in the Social Security, do you think that this is understandable by the French today? Well, I think that this franchise-related topic must be placed into a broader context. I don't know whether François Lenglet shares this specific opinion, but I believe that there won't be any relaunch of the budget, of the French budget, without any reforms of the social models, because I don't see any possible way for that. When we're looking at the public expenditure, especially for the last 30 years, and specifically for the last 80 years of the presidency of Emmanuel Macron, we see that the part of the redistribution is practically swallowing all the rest, and also the regalian interventions as well. So meaning that we are taken more and more so that to redistribute to the most necessarily and most Barocco forms, I would say. And when I'm talking about Barocco, this is basically this financement of electric vehicles for some people, and also some primes for the renovation and things like that. So that's what I call Barocco. And I think that this is the approach that has to be reformed in depth. So I think that the goal here is to probably place our attention differently between the collective and individual risk, because we placed it somewhere at a certain point, but for this last 30 years, we diminished little by little the part of the individual risk. And of course, all of this had a negative impact on the collective risk, because the collectivity has to pay more because of that. And just to illustrate that, we can see many different phenomena and many different impacts on the social sectors. Well, we have had some recent reforms as well, but globally, if you are comparing the insurance that exists today to the one that existed 30 to 40 years ago, we see that, for example, for the jobs and so on, it is much softer, and much more flexible than it was before. So I think that we have to broaden the part of the individual risk a little bit with precaution as well. And it also should apply to the unemployment and for this conventional firing, as we call it, that are basically a friendly way of parting ways between an employer and an employee. So this is pretty much without a real firing procedure, and the social money is being paid for that. But at the same time, this same system has to apply to, of course, the medical fees. The plan of de Gaulle in 1958 was done when France was in a very specific situation. And you also know that there was this ROEF plan that has been asked by de Gaulle so that to re-establish the finances of the country and the competitivity of the country. And one of the things in this plan was the creation of this medical franchise. And it was basically 3,000 francs of back then per semester. And I actually counted the equivalence. So this medical franchise that has been imposed by de Gaulle, so it's not no one, it's an important figure here. And he's basically the founder of this French model. So he imposed a franchise that is equivalent to 130 euros per semester, meaning 260 euros per year. So just imagine the consequences that it would have had today in terms of the budget. So it would completely change the equation of the social security. And I'm coming here once again to the question that you have asked. I believe that it will be accepted with a lot of difficulties, because we no longer have the habit of all of this. Because, well, we have this franchise for 50 years for the drugs, and this is something that is already quite difficult. Because, well, we understand that for France, we actually had different periods of history. Well, this was not slavery or liberalism in its purest form. This was the time of de Gaulle. And this was the time when we have asked to the citizens to contribute a little bit more, with the exception of the citizens that were the poorest. But I would say that if back then it was done, why not now? Why couldn't we do it now? So this is about the patients. So you say that the patients should pay a little bit more, and then for the rest, we also have the expenditure of the uh, health insurance, social security that will be financing the rest. And you also said one day that the social security doesn't need a fiscal advantage, but they actually need to make the situation a little bit more strict. So you have been talking about all of this when you were talking about the prescriptions for the transport, for all the different other fields. But this was not really the core of this specific topic, but the core of the dependencies, of the expenditures of all the healthcare professionals are an important issue right here. Yes, of course, this is a very important question you're mentioning right here. So now I would say that first of all, we have to stop. And when I'm saying that, you have reminded it very kindly. So we have to stop focusing on the resources, meaning on the taxes, because this is something that brings us farther and farther from the question related to the improvement of the efficiency. And that's exactly the same thing for all of the social sector, not just the healthcare, meaning the protection against the unemployment, but also for the budget. And it actually goes back to the question that Elisabeth has asked before that, meaning that today we are just talking about these taxes. But the topic is not to remove the taxes yet, despite the fact that we are right now at the highest point for the taxes. We are at the worldwide record practically, and François Lenglet has talked about this. Well, of course, it varies from one year to another, and from one year to another, probably one or another Nordic country is topping us up. But right now, in terms of the efficiency, we are kind of struggling. So I would say that this debate about the resources and the taxes is not the right topic. And we have spent 30 years trying to find the new resources for the social security. Soon we will be imposing taxing the air that we're breathing. So we have to stop. We have to stop with all these taxes, especially for the middle class, because right now we see that the rate of the taxes for the middle class is very, very high, despite the fact that we have the services that are still quite good, despite what some might think, but the quality is quite good. But nonetheless, well, the efficiency could be improved here. So when I was saying that uh, we have to rework on our approaches, I was not really thinking about the society, but about the consumption. And it's actually quite a fine line, because here, once again, I'm talking about the moving of this point related to the risk. For example, the transport for the healthcare, but also the incredible increase of quantity of sick leaves, and the determining parts of the evolution of the costs of health are here. So this is not specifically a French problem, because we see this in Germany as well. We also see it a little bit in the UK, despite the fact that they have the refund system that is more modest than what we have here. But this is also a big question here, the question of awareness rising, but also of increasing the responsibility of each and every one. And here, well, I'm not really starting this debate about the sick leaves and things like that, what could be deleted, what could be reestablished or whatever. I think that just as such, this issue is not very seriously presented. And I think that the moment has come for us to look not just at the sex of people, but of the problems that are in depth of all of this. And here we also have the ALDE with the beneficiaries that are increasing in a very important way. But when we are comparing all of this to what is happening in Germany, and you know it better than me, but because we know that the number in terms of population is a little bit lower than what we have here. And I don't think that they are somehow stronger than us, and they have less pathologies than we have here. But coming back to the production system, yes, indeed, it also has to influence the system of the care production or care provision, not just the hospitals, but also all the different services. I think all the different stakeholders that are around it. I think that there is a huge work that should be done here, and probably deleting the doubles and somehow decreasing the workload, for the administrative workload and so on. So there are many things that we can work on. Just to go back to this report that has been presented, approximately 15 billions were given to the hospitals so that to fight against that. And now when we're looking at the current situation, we see that it didn't change, meaning that we basically address the symptoms, but not the cause. So this is bad. This is why I'm talking about really tackling the cause and not the outcomes. I'm reading these reports, and I think that this is starting to see this lightness, this easiness with which we have given this 15 billion just for this debt, and it actually had absolutely no result, and it did not. And the review and the re-examination, reassessment of the system has not followed all of this. And probably the last question that I would like to ask you, it's about the difficulty of the reforms at the level of the social security, because you actually said that the French don't really want to see their healthcare system as a system that is part of the economy, and they don't want their social model to be attacked. So facing these difficulties, but also facing the very important deficit that has been generated by the healthcare system, do you think, or do you probably feel that it is a threat? I mean, the radical reforms that can be inspired by the neighboring countries, meaning the privatization that exists in Switzerland, but also in the Netherlands. So we don't have just the United States as an example here, or probably a different way, the way of decentralizing everything. This is also something that we can see, let's say, in Spain, and this will be the healthcare systems that are managed by the regions. So do you think that these alternatives should be considered? Well, once again, Franck, the question that you are asking is broader than the health care itself, because this question is also very relevant for all of these state sectors and everything where the state is basically doing something. I would tend to say that the total privatization is a no, because here we are attacking the very core of the social model, French social model, and there is no reason that the state will step away from all this efforts in terms of the increasing the efficiency, because it still can be very efficient if it works sufficiently. So I think that this is a very, very important point for France specifically, and this is this match, this mix between the public and the private sector, with everyone having finally their own philosophy that matches very well the other's philosophy. But the other question is also, well, I was actually saying that this is quite a broader problem, but it actually goes to the other thing. Recently, we have been talking about the complexity of different operations, and the simplification would have been an important way out here. But that's very complicated to simplify things. And this is why, facing this simplification, we have seen multiple laws that actually appeared, for example, for the reconstruction of Notre Dame, but also for the Olympics in Paris. And this was also in the law of Bruno Le Maire 2 or 3 years ago for the construction of important industrial projects, meaning that it became so complex. We have so many layers of normalization, standardization, and also complexification in the French system that even the law recognizes that it is no longer efficient. And in depth, there are the fast tracks that are already foreseen that will allow us for the big projects to somehow go around all the rulings and regulations. And I also see in the European level, and probably some of you were also very curious and you read this Draghi report on the ancient president of the Italian Council and also the ancient president of the bank that actually was talking about the difficulties at the European level. And finally, it says that the administrative complexity is such that for the creation of a company, we should create the 28th country, a fictional country that will be called Europa or whatever. That will be very, very simple. And we will create a way of registering companies that will be accessible to all the citizens of all the European Union. So it will be very easy to register our company in this Europa country, to have a fiscal and regulatory regime that will be simple simplified. So this will be kind of a fast track against all of this complexity, administrative complexity of that has been created at the European level. And I have also heard a German colleague from the German politics who talked about the same thing. He said that we shouldn't waste too much efforts doing that because it's too complex and we will have to ratify it in the 27 countries. So it's easier for us to just walk around all of this and to work at the intergovernmental level. So probably for the healthcare, some experiences of decentralization can be carried out as well. So why not? I think that it could be a good solution because right now for French, it's kind of difficult to get inspiration from what is happening abroad, but we probably can get inspiration from a pilot region that will be working in the first line and being a pioneer in terms of healthcare, for example, because healthcare is also one of the goods. Well, we do not perceive it as part of the economy. Nonetheless, we still have important stakes that are here and challenges as well. So it can be a very interesting experiment, I would say. And the outcome of this story, the conclusion of this story is that probably we can reform this hydra of Hercules that has its heads growing once we cut them, to be pragmatic here and to start experimenting and probably find some
Bon,
solutions that tomorrow
François,
will be able to
merci.
inspire the whole country. Well, thank you so much, Francois.
En,
Thank you for these insights.
en quelques mots, vous avez
Just in a
tracé à la
couple of
fois un
words,
peu
you were
l'avenir,
able
quasiment
to
débordé sur
talk
d'autres
about this
sujets qui
future and to
pourraient
give us
être des
this
débats
guidance
de
toward the
charme dans
future,
le
but
futur.
also
Nous rigolierons pas,
mention
et j'espère que
different
ce jour-là,
topics
vous serez
that can
présent
be
de
topics
vous
for the
réunirez.
debates for the
Mais
future
vous avez
shams, and
évoqué un
hopefully you will
fonctionnement plus
be
simple,
coming and
mais
present
néanmoins plus strict,
physically.
moins
But you have
laxiste,
also
puisque d'un
talked
côté, vous
about
tracez
this
sur l'avenir, et
simple
de
but
l'autre
more
côté, vous
strict
dites, il y
approach
a
because
30
you were
ans, on
talking about
savait
the
être moins laxiste,
laicity,
plus
but
strict.
also you were
Moi, ce que je
talking about the
constate,
situation
et ce sera
30
mon
years
petit mot
ago.
de la fin,
So
ce que
what
je
I
constate,
am
c'est qu'on est
actually
plutôt
seeing
en train de
here, and
renouer
this will
avec
be
des
my
idées d'il y a
conclusion, is that
45 ans,
we'll
quand je revois
probably
effectivement
have
surgir
to go back to
les
the
prémices de
ideas
l'ISF.
45 years
Merci,
ago. And this is something
merci,
that I see when we
merci
see this
François.
ESF
Bon débat ce
that is
soir.
coming with their ideas. So thank you very much, Francois. And I wish to you great debates tonight. Well, thank you very much. And I wish to you a
Tout le monde
great
va comprendre ce soir
work
en vous regardant
and
sur
a
LCI.
great meeting.
Merci.
And hopefully we will meet each other next year during the
Merci.
next CHAM.